My name is Brianna Buford. I am a healthcare administration major and I am a senior. I aspire to become a labor and delivery nurse and midwife after graduation. I also have a 2-year-old daughter, so deciding the policy that I wanted to discuss in this video came very easily to me. I found two policies that interest me the most that I think would make the best impact on healthcare, and the first policy is the Maternal Care Act. This policy was introduced by Vice President-elect Kamala Harris, who at the time was running for president. In this act, $25 million go to medical schools, nursing schools, and other health care professional training schools to reduce the amount of racial bias occurring in healthcare. This would change the chances of an expectant mother's story ending how Kira Johnson's story did. Kira Johnson went in for a routine scheduled C-section, and during surgery, her bladder was nicked and she slowly bled out. By the time the mistake of internal bleeding was discovered, it was too late to correct, and Kira ended up dying. Decreasing racial bias between nurses and doctors with their patients leads to a better quality of care for patients, more patients trusting their providers, and a better relationship between patients and providers, which would lead to patients being more honest with their providers so that they can genuinely get the correct care that they need. The second policy I discovered was the Mommy's Act. This policy will expand medical coverage for pregnant women from 2 months postpartum to a year postpartum. It would also increase the access to women's health providers and primary care physicians. This bill was introduced by Senator Cory Booker, who also wanted to decrease the maternal mortality rate. This policy would prevent unnecessary deaths like Shalon Irving. Shalon Irving was a first-time mother who died days after delivering her daughter due to high blood pressure complications that went unnoticed by her healthcare providers. Because her high blood pressure got so severe and went unnoticed for so long, about 2 weeks after she delivered, she had a heart attack and did not survive. These two policies would reduce racial bias from providers while also ensuring mothers have access to health care long after delivering their child. The maternal mortality rate in the U.S. was 17.4 deaths per 100,000 births in 2018. With the U.S. spending so much on health care, the maternal mortality rate shouldn't be as high as it currently is. With the implementation of the Mommy's Act and the Maternal Care Act, there would be a significant increase in the maternal mortality rate. And the decision of which policies to choose became easy because when I had my daughter, I was terrified that I was not going to come back home. And that is not something that should happen in healthcare, especially as much as we spend on healthcare, and the fact that it's black women are 4 or 5 times more likely to die from complications related to childbirth than a white woman is also something that should not continue. And that's why we also need more policies on maternal health rate, because it's not being tracked, it's not being looked at, and they're just seeing that people are dying after they're having their kids without noticing the correlation of the racial bias or the care, where it results in them not being able to have access to their care because they don't have the insurance or the Medicaid, or don't trust their providers because when they were in the hospital, their providers did not listen to them, as what occurred with Shalon and Kira, because both tried to speak with doctors before their passing and explain to them what they felt, and they were ignored, and because of that, they lost their lives. Thank you.